Well, hello again, everybody. Welcome back into the Keep Boone Healthy Facebook channel. I am David Jackson with the Boone Area Chamber of Commerce, and today we are talking about types of vaccines that are available here in Watauga County. Some excellent news coming earlier this week that the Johnson & Johnson vaccine is now available as part of the community-wide vaccination efforts here. So we wanted to provide an opportunity for you to learn a little bit more about the nuances of that particular vaccine and kind of hold that up against the two others that are available and have been available in our community for a while. So to do that, we bring in our resident pharmacy expert, the Director of Pharmacy for Appalachian Regional Healthcare System, Sean Burroughs, joining us here today. Sean, thanks for joining us, and I guess congratulations on having a new tool to be able to use. A third vaccine, I know, really makes things a lot more dynamic for your efforts to get as many vaccines out to as many people as possible now.
Yeah, it's great news, and I think all three of them provide the benefit that we're looking for in a community. Logistically, it poses somewhat of challenges as far as having three different ones to kind of work through, but we were very fortunate and excited to hear that we would be, as a community, getting some of the Johnson & Johnson or Janssen vaccine this week. Yeah.
So what can you tell us about that vaccine? It being the newest on the market, what are some of the details about this one-shot vaccine that folks have heard so much about?
Yeah, so the Pfizer and the Moderna are their mechanism of action is a little bit different. They're messenger RNA, and they get delivered to the cells on small lipophilic molecules. The Johnson & Johnson vaccine is a little bit different. It actually is encapsulated in an adenovirus, so a virus, inactivated virus that's not going to cause you to have symptoms of a virus, delivers the Johnson & Johnson vaccine to the cell, and once it gets taken up by the cell, the spike protein ends up forming similar to what the other two vaccines do. So not to get too technical, but they are a little bit different as far as how their mechanism of action works. But both of them end up developing the immune response. Your body develops an immune response to the spike protein on those molecules, and you develop that response and help get your immunity built up for COVID. Now, I'm sure we'll go into a few more details as we continue on. So.
Yeah, that's a good technical start for us for sure. And I think that is the important part of this kind of discussion, is for us to be able to lay out to folks that are maybe scheduled for a clinic this week, or they're hearing about new resources that are available in this and are trying to improve their knowledge about these different types of vaccines as they prepare to maybe get vaccinated in a future round. If you can take all three of them and kind of go down that road and maybe give some of the highlights, side effects, and maybe what people can expect with these three different vehicles for vaccination that we have available for us here in the high country.
Yeah, absolutely. And I'm certainly fielding more and more questions about that from folks in the community. And so to summarize them, you've got your Moderna and your Pfizer, and those, when they were studied, had 95% efficacy. Those were studied at a different time than what the Johnson & Johnson was studied at. So it's difficult to compare efficacy numbers between Pfizer and Moderna, and the newer one, Johnson & Johnson, that has been studied potentially against some of the new variants that are floating around out there now too. So if Pfizer and Moderna were studied at the same time Johnson & Johnson, they may not come back at 95% efficacy. So it's hard to say Johnson & Johnson isn't as effective, even though the numbers are a little bit different, because it's a different time period. And some of the criteria used in the studies was a little bit different. So I want to first say that I'm comfortable with all three of the vaccines and the efficacy that they provide. Johnson & Johnson is a one-dose vaccine as opposed to Pfizer and Moderna, that's a two-dose vaccine. There are benefits of a one-dose. Obviously, you don't have to get the second dose. The side effect profile of the Johnson & Johnson vaccine is a little bit different than the Pfizer and the Moderna one. For those that have received Pfizer and Moderna or have heard about it, the first dose of those Pfizer and Moderna don't seem to cause a lot of side effects. The second dose of both of those, the Pfizer and Moderna, seem to have some significant side effects that last a day or two, and then usually people recover from that. So Johnson & Johnson is a little bit different. It doesn't have as many side effects as the second doses of Pfizer and Moderna, at least in the studies. Now, it's just out this week, so we don't know for sure what real-world data is going to look like. But when you compare the studies, the Johnson & Johnson vaccine, the side effect profile is a little bit less than what it is than the second doses of the Moderna and the Pfizer vaccine. So that's a good thing, for sure. You don't need that follow-up. And one thing that I do want to stress for people that have looked at the Johnson & Johnson vaccine and say, you know, it's only 70% effective. I'm not sure that that's the one I want. Maybe I want to wait for the Pfizer and Moderna. There's a couple things with that. If you don't accept the vaccine that is presented to you at a given time and you choose to wait, it could be weeks or potentially even longer before there's enough supply to be able to get the vaccine that you want. So vaccine shopping is a little dangerous. And the second and most important thing is that after 28 days of your Johnson & Johnson vaccine in the study, there were 0 hospitalizations and 0 deaths. And that's really what we're shooting for. You know, you want it 95% efficacy, 70% efficacy, but what we're really looking at is preventing hospitalizations and death in our community. And from the studies that came out after 28 days after your Johnson & Johnson shot in the studies, there were no deaths and no hospitalizations noted after that. So that, to me, that's huge. That's a great thing. So we do have 3 really good options right now.
Well, and I think that you hit the exact next point that I was moving toward, and that is, you know, as we've got this new vaccine to create a trio, if you will, I think it's also been a great opportunity to bring back up the reason that these vaccines exist in the first place, and that was to limit the strain on the overall public health and health mechanism that is hospitalizations, that is you know, people kind of clogging up the system because of having these issues. And it seems like all 3 of these are delivering on that. Is that probably the biggest messaging that you see from the medical community right now is more of a, remember why these exist. They do exist to keep you healthy, but they also exist to make sure that the strain on the medical community is not as great as certainly some areas of the country, and even we at times have seen here locally.
Yeah, I mean, first and foremost, that is the reason that we want to get vaccinated. You know, you want to look at the endpoint of decrease the amount of hospitalizations that you have and the pressure on the health system. But number one to me is, if you get this vaccine and that helps, you know, decrease mortality, that's the gold standard. That's what you're looking for. Nobody wants to be sick, even with mild or moderate symptoms of coronavirus or the flu, be it the flu. But the fact that these vaccines help prevent hospitalizations and help prevent deaths helps the health system. But that's kind of what you're looking for when you have a vaccine, and that's kind of what we need out in the community. So the more people that get vaccinated, and we've seen that, it's not all due to the vaccine, it's due to, you know, masking and social distancing. But from where we were in the middle of January to where we are now, at least at our health system, it's night and day. It's amazing. So we have made great progress over the past couple months.
Yeah, and the less folks that are in the hospital dealing with COVID-like symptoms, that means there's greater capacity for other folks that need to utilize those healthcare services for so many other things too. And that's certainly important in a community like ours. A last question for you, Sean. I know you mentioned vaccine shopping, and I think that was an excellent point that you made of understanding that it might not be best to wait for the exact one that you want. They're all effective in their own unique way. Can you tell us any more about supply at this point in time, and what the Johnson & Johnson stockpile looks like in terms of its deployment? And you know, it seems as though, you know, here over the last few weeks, we've seen both Pfizer and Moderna continue to produce more. That means that more gets to the states, which ultimately brings more to the counties. Do you still see positive progress in all of those being deployed at a level that you like to see as a provider in getting those shots in arms?
Yeah, so the community, the health department, the hospital initially started out with Moderna, and that's what we continue to get. We continue to get a steady baseline of Moderna. Now, when we've had events, such as at the high school at the rec center, we were able to get Pfizer for those events. And the Johnson & Johnson vaccine, technically we called it an event, but we're spreading it out over the course of a week to be able to distribute 2,000 doses over the course of the next 7 days. So those are more event related, that if you submit a request for events, you can get the Pfizer's and the Johnson & Johnson, whereas Moderna's really been our baseline workhorse for the past 2.5 months. Moving forward, it's hard to tell what they're going to do with the Johnson & Johnson. From what I had heard initially, the state got 80,000 doses, but they were holding those specifically for events, so they didn't send those out as baseline allocations to the community. Now, what happens, once we get through March or the end of March and into April, how they're going to distribute the different vaccines is still to be determined. Personally, as far as the amount that we're getting, the state has been really helpful as far as getting us event doses of Pfizer and of Johnson & Johnson, and I hope that continues. I would love for us to be able to move through the phases even quicker than we're moving through now. I have a feeling that we're going to really make a huge dent into phase 2 in general over the course of the next week, and I would hate to be waiting a week or two before they allow us to move open to the next phase. So the supply for the phases that we're in is good, but as the phases get broader, more and more vaccines needed, and I'm hoping that we continue to increase the supply that we're receiving from the state.
Well, we certainly appreciate you spending some time kind of laying all this out, both from everything from the efficacy of these vaccines to the process that they are being deployed here in our community, and continue to thank you and all of the partners that are involved in the community vaccine effort for the tireless work that you're doing to make sure that this goes as smooth as possible and folks can get access to these vaccines in a timely way. Best of luck with the next several days. I know that there are a lot of clinics coming up here, and we look forward to hearing about more vaccine going into the arms of high country residents, and appreciate your role in making that happen.
Yeah, and David, I'd just like to thank the community in general. We have people that so want to be involved in the clinics as volunteers, and we don't have the space for them. And we're moving through all of our vaccine. It's just the community response has been incredible as far as just wanting to be a part and coming to volunteer, and we couldn't do it without them. And it's been awesome to see. So I appreciate all that you do to help distribute the information out to the community and all the volunteers that have helped out.
Thank you, Sean.